Good evening, ladies and gentlemen. Today I'm here with Dr. Sandeep Shankar, Interventional Cardiologist and Associate Professor of Cardiology at Jayadeva Hospital. And right now I am here at Sandeep Shankar's clinic, which is Dr. Sandeep's Heart Care Center and Labs in Basveshwara Nagar, Bengaluru. So, we are going to talk about a really important health topic today, that is cholesterol, a silent killer, and the importance of early detection in the young adult population of India.
Namaste, I'm Dr. Sandeep Shankar. I'm an Associate Professor of Cardiology and an Interventional Cardiologist at Jayadeva Institute of Cardiology, Bangalore. I'm giving this podcast in my clinic, Dr. Sandeep's Heart Care Center and Labs, which is in Basveshwar Bangalore.
So, Doctor, I welcome you to the podcast. So, let's start by addressing a key concern. Why should young Indians be concerned about cholesterol?
Thanks for leaving me into this podcast. Uh, I'll start with your concern. Now, in India, 1 in 5 adults has dyslipidemia and high cholesterol levels. The LDL cholesterol, which is one of the most important markers of cardiovascular death and disease, it is high in 1 in 5 adults in India, and it's one of the most modifiable risk factors for the heart disease. About 28% of the total deaths in India are due to heart diseases, and 25% of the deaths below 40 years are due to heart diseases. This clearly shows the high cholesterol levels in our young population place them at a greater risk of heart-related illness and mortality and morbidity.
Okay, so this is a very major concern in our country. Is that what you're saying?
Yes, it's a very major concern. 25% of the adults below 40 years are succumbing to heart disease. It's a major concern. There's a working population of a country.
Okay, Dr. Sandeep, next question I want to ask you is what are the factors that contribute to the high rise of cholesterol in young adults in India?
In India, Indians tends to experience heart disease earlier by a decade compared to the Caucasian and other populations. Why is the reason? This is because of high cholesterol levels, high LDL cholesterol, bad cholesterol levels, which is one of the critical risk factors. Several factors are contributing to it. Normally, Indians have a low food consumption and low fiber consumption in their diets, more of processed foods, fatty foods in their diet, which will contribute to that. About 50% of the Indians have sedentary lifestyle. This also contributes a major part to the high cholesterol levels and subsequent heart disease. There is certain genetic predisposition which makes Indians more prone to high cholesterol levels at younger ages. These elements combined with younger ages significantly raise the risk of high cholesterol levels and cardiovascular disease in our populations. Earlier, we used to have famines about 100 or 200 years back. We used to have famines. Our genetics are tuned to low calorie consumptions. When you're having abundance, we tend to develop diabetes earlier, high cholesterol earlier. So we have higher risk of heart disease compared to Caucasian population.
Okay, so it's because of the famine that we have evolved in such a genetics have evolved.
Genetics are like that.
Because of
We
the
have
famine.
heart disease about 10 years earlier than the white population, Caucasian population compared to Caucasian populations. And then even our calories are smaller compared to them.
Okay, so that combined with our lifestyle and food consumptions as well.
Yes.
Okay, so doctor, what are the risks associated with high cholesterol levels in young adults and how does it impact long-term health?
High cholesterol levels, especially if it's unchecked, can have severe long-term health consequences. High cholesterol levels will lead to the plaque buildup in your arteries all over your body. If plaque buildup is in your heart, artery supplying the heart, you have a heart attack. You can have early strokes, peripheral vascular disease, and there's a major burden of this happening in India right now in the ages of 30 to 40 years, but even 20 years. I've seen heart attacks at the age of 21 years with no risk factors.
Okay.
This is what is happening in India. We have a tsunami of cardiovascular disease.
Okay, so doctor, it seems that cholesterol is a very, very huge issue in this country. I mean, even the youngest of the young people are facing issues and they are, getting heart diseases, heart attacks, and things like that. So, what can be done to help the young adults understand their cholesterol levels?
Making our young adults understand is early screening. We have to screen every young adult at the age of 20 years or below that for the cholesterol levels. It's crucial to know whether they are in borderline or high cholesterol or normal cholesterol levels. They should make informed decisions on lifestyle modification, dietary modification, and medications if necessary. It is also essential to check the family history of all the individuals involved. There are diseases which are carried through families, familial hypercholesterolemia, which have a high risk of heart disease, which carries through families. So early screening is the key for us.
Okay, and it is especially important if somebody already has a family history of high cholesterol.
If someone has a family history of high cholesterol, screening is the key to know where he stands, where or he or she stands.
Okay, so doctor, could you please tell me why early detection and early screening so important for the young adult population?
By checking the cholesterol levels of any individual, having a baseline cholesterol and regularly checking your cholesterols can gain you early insight into your heart health and early detection. You can take charge of your health and make healthier lifestyle choices. Exercise can be part of your routine. You can reduce the processed foods in your diet. You can go for more fiber in your diet. Make exercise a part of your life, and significantly reduce the it can significantly reduce serious conditions like heart attacks, strokes, and make our population healthier and be healthier and productive. That's the most important thing. You should have a productive population.
Hmm. So, as everybody says, prevention is better than cure.
100%.
Yes. So,
It's a daily fight. Having a good diet is a daily fight against your plate.
yes.
Avoiding the processed foods, sugars, and sweets, sugars, junk foods is a daily fight against your stomach.
That's true. So, what can be done to achieve, for us to achieve early detection?
Early screening. At least screen every adult at the age of 20 years to know the cholesterol levels, and regularly screen at the interval of 1 or 2 years so that you know where you stand.
So, Dr. Sandeep, can you please tell me what can help us achieve early screening of cholesterol?
Much like Cidil score, which denotes your financial health, people have come up with a Cidil score, which denotes your cholesterol investigation report or health.
Okay.
By determining the Cidil score early, doctors can proactively manage your risk factor for future heart diseases, helping you remain young at heart as you age.
So it seems that this CIDIL score, CIDIL score, is very, very important. Could you please tell me exactly what it is, how it works?
The Cidil score stands for Cholesterol Investigation for Dil. The initiative launched in the public interest. It involves tests that assess your cholesterol levels, the most critical risk factor for heart disease. Conducting cholesterol investigations and the Cidil campaign, individuals at risk can be identified earlier, screened earlier, and guided towards informed choices and lifestyle changes that promote a better heart health.
So, Dr. Sandeep, we have talked a lot about early detection, and you just told me that everybody needs to get a CIDIL score. So, could you please tell me what a CIDIL score is and how it works?
The Cidil stands for Cholesterol Investigation for Dil. The initiative launched in public interest. It involves tests to assess the cholesterol levels, the most critical risk factor in the critical and modifiable risk factor in the heart disease. By conducting cholesterol investigation and a CIBIL score on knowing cholesterol levels, it can help in early detection of high cholesterol and treating it when necessary, and making informed choices and lifestyle changes if necessary for your heart health.
Okay. So, it is a very important thing that a person should get done. Can you tell me how a person who is, interested in bettering their health get their CIBIL score done?
You can you can visit the screening center for testing your cholesterol levels, or meet your physician with your reports, cholesterol reports, so that he can assess your score and give you a plan to manage your cholesterol and make healthy lifestyle choices.
Okay, so Dr. Sandeep, what exactly is the objective of finding out the CIDIL score?
The main objective of finding out the CIDL score is facilitate the early detection of heart disease and high cholesterol levels,
Okay.
encourage young people to consult doctors with intervention if their cholesterol levels are high, and raise the public awareness about your high cholesterol levels, and encourage them to make choices towards healthy lifestyles and exercise wherever it is necessary, and medications if necessary if your cholesterol levels are high.
Okay. So one thing is that it is very important to get a Cidil score done. But other than that, I would like to ask you, what is the ideal Cidil score for a young adult?
Normally, if you go under the lipid profile,
Hmm.
your total cholesterol should be less than 200,
Hmm.
LDL should be less than 100,
Hmm.
your triglyceride should be less than 150,
Hmm.
and your HDL should be more than 40.
Okay.
HDL is good cholesterol. More the HDL
Hmm.
cholesterol, the better you are. The
Okay.
lower the LDL, better it is. Nowadays, they are going for in heart patients. Many studies are suggesting come down to the cholesterol levels of about 40, 30
Hmm.
LDL.
Hmm.
So that might reverse your heart disease if you have heart disease.
Okay, so good LDL is very, very important, is what you're saying.
No, high LDL.
High LDL.
High
High
LDL
LDL.
is not important. High
Okay.
LDL is dangerous.
Okay, it is
High
dangerous.
HDL. High density lipoprotein is good cholesterol.
Okay.
LDL is bad cholesterol.
Okay.
Lower
Okay.
the LDL, higher the HDL.
Okay, okay, that makes a lot of sense. And other than that, are there any suggestions that you would like to give to the people of India, just in general?
To prevent complications from heart disease, go for early screening for cholesterol,
Hmm.
make lifestyle modifications, and daily exercise
Hmm.
routine in your life,
Hmm.
and check your cholesterols. If your cholesterol is high, don't hesitate from taking medications,
Hmm.
making lifestyle choices,
Hmm.
and encourage other people in your community to take cholesterol tests, make lifestyle changes,
Hmm.
avoiding junk food, cigarettes,
Hmm.
alcohol, all should be avoided. Maintain a healthy, balanced diet, and even yoga and meditation helps you to maintain a good heart health.
Hmm. Okay, so I mean, stress is also a huge factor in today's lifestyle.
Yes.
How does that affect cholesterol?
See, the more stress you have, more cholesterol you have.
Hmm.
Stress causes your stress hormones to go up.
Hmm.
That will cause
Cortisol.
chronic cortisol to go
Cortisol.
up, epinephrine,
Yeah.
norepinephrine, everything to go up.
Yes.
That causes chronic inflammation in your body
Hmm.
and raises the sugar levels, then cholesterol levels. Stress itself is a major cause of heart disease nowadays.
Okay, okay. So yoga and meditation, as you said, are very important.
Keeping your mind healthy is also very important.
Yes, yes. Okay, sir. Thank you very much for this conversation. It was very, very helpful, and I'm hoping that the viewers who watch this also find it very helpful. And also, I encourage everybody to go and get an early screening, as said by Dr. Sandeep.
Thank you. Thank you for having me a part of this podcast. Thank you once again.
You're welcome.